Today is Saturday, November 7th, 2020. My name is Mariana Navarro, and I am interviewing Daphny Ainslie for the Voces Oral History Center at the University of Texas at Austin. Please know, Daphny, that this interview will be placed in the Nettie Lee Benson Latin American Collection at UT Austin. If there is anything that you don't wish to answer during our interview or talk about, I will honor your wishes. Also, if there's anything that you want to talk about that I don't bring up, please bring it up and we'll go ahead and talk about it during our interview. Because we are not conducting this interview in person, it's through Zoom, I do need to record you consenting to this. So I'll ask you a series of 5 questions. Please say, yes, I agree, or no, I do not agree after each one. There are a couple of questions that we need to make sure that you agree to before we continue with this interview. Voces wishes to archive your interview along with any other photographs or documentation that you provide to us at the Benson Library at UT Austin. We will retain copyright of the interview and any other materials that you donate to Voces. So the first question, do you give Voces consent to archive your interview and your materials at the Benson Library?
Yes, I do.
Wonderful. Do you grant Voces copyright over your interview and any materials that you provide?
Yes.
And do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes.
Wonderful. And then we had many questions that we asked you, or that I asked you during our pre-interview form a couple of weeks ago that we already filled out. We use this information from the pre-interview form to help in any research that gets done during this time. The entire form is kept in a secure Voces server, and before it was sent to the Benson Library, we would have stripped out any contact information for yourself and for any family members that you provided to us, so that will not be a part of your public file. Your public file will only be accessible at the Benson Library. Do you wish for us to share the rest of your interview in your public file available to researchers at the Benson?
I don't understand the question. So you're asking to be able to share the initial portion that we covered?
Correct, yes. Stripped of any contact information that you have.
Stripped it, so it's all anonymous information?
Yes, they'll have your name, but they won't have like your address or your place of residence, anything like that, phone numbers, they won't have that.
Yes, I think that's okay.
Okay, great. And then on occasion, Voces does get requests from journalists who wish to contact or interview the subjects that we have interviewed. Voces does only deal with legitimate news sources and legitimate news outlets. Do you give consent for us to share your email with journalists or your phone number with journalists who want to do research during this time?
No.
Okay, perfectly fine. Okay, great. So that is the end of our preamble, the end of our spiel. So now we are going to get into the actual interview. So for the first things first, can you just tell me a little bit about yourself, about your life, what you did when you were younger, what you did during your teen years, and now? Can you just tell me a little bit about your life?
Wow, yeah. I mean, I currently am married. I have 2 boys who are elementary school aged. So I stay very busy with them and with my husband and doing having our family life. In addition to that, I work as a psychologist. So I stay very busy in my private practice, and, basically I'm always trying to find ways to make my life work given all of the different demands on it. That being said, I think we have a very fortunate life, and we're all very well and healthy, and we have a lot of love and support around us, which is really provides everything. I mean, it's our lifeline, it's sustenance, and it's been really important during this time. Let's see, I've been in Austin since 1997, kind of off and on. I left Austin to go to graduate school in San Antonio. And prior to Austin, I grew up in Rockport, Texas, which is a very small, beautiful, amazing town on the Texas Gulf Coast, which is where my family has been from for forever. My parents are still there, along with some siblings, and being in touch with them and having contact with them is also so important and relevant to my life and the lives of my family, my husband and my children as well. So, yeah, I think that's it.
Wonderful. And you are a psychologist, so can you tell me a little bit about your professional background, what you've done as a psychologist during your time?
Sure. So let's see. I did my training in San Antonio at Our Lady of the Lake University. And in that program, I did a number of things, from really getting in some clinical hours related to practicing psychotherapy. But I also did a lot of assessments. So a lot of my training is I went out and got some assessment experience with another psychologist or psychologists in Central Texas, which was really valuable to me. Part of my training, I did my internship and my postdoc at the Central Texas Veterans Healthcare System. So I worked at the VA, did the bulk of my training at the VA in the last 2 years. And that was in the areas of post-traumatic stress disorder and substance use disorders. So not only was I interested in learning more about working with, researching military veterans, and also kind of first responder types. I mean, that's been an area of interest of mine. But as I was doing that, my interest in psychological assessment was also growing. And so I continued to do both, to work clinically, to do a little bit of research, and also to build up my assessment repertoire. And as I moved through that and became licensed, I continued working with veterans, which was really amazing and interesting. But also I started building up a forensic psychology practice. So at that time, I was doing more and more psychological assessment and started working with the courts in Texas. So Central Texas and kind of greater Texas, if you will. And that was in the area of working on civil and criminal matters, consulting with attorneys related to psychological questions, working as an expert witness in different areas of psychology, testifying about different subject areas. So that's been basically what I've been doing more recently, I'd say, for the last several years. And that's been the bulk of my practice, including having a clinical practice. I do still see patients in therapy, which has been really great. I think I do really well when I have a number of different areas, a diverse set of areas that I work in. And so that's been really interesting to me. I think I'm always learning more, which is amazing. I mean, I feel very lucky to work in a field, in an area where I am constantly meeting people and belonging to organizations and learning more about the different areas that I have of interest.
That's great. And you talked to me right now just a little bit about what you do, how you love what you do, but how and why did you first become interested in studying psychology? How did you know that this was something that you really wanted to do with your life and that you wanted to pursue and make a career out of?
Well, I think one of the things that I've always been drawn to is questions and remaining curious about people, and letting that curiosity open up different ways of contacting people and engaging with them. So in my work related to family law, being curious about families, being curious about parents and children and family systems and how they work together, and what recommendations can be made to help those family systems improve and develop and change whenever families change. And so that has been, something that continued to drive me. Same thing with criminal cases. There's situations where things happen, and I think one of the charges that we have is to try to understand that for prevention purposes for the future, but also try to kind of help people get the resources that they need to prevent future problems. That's really relevant and important. The question of psychology has always been on my mind. I had a great teacher in high school that was a psychologist, and he came in and taught like a semester of psychology, super basic, but I think that really piqued my interest. I knew at that time this was an area that I wanted to pursue. I had no idea at the time how to do that. So it was just kind of like doing one thing, taking the next step and following it, and, really settling into, the length of time, dedication, money, expenses, resources would need to be put into pursuing a degree in this. And even now, continuing education and participating in on panels and talking more and more about these areas. It's really great. I mean, I really feel fortunate to have a area that I really, really enjoy being in.
Really goes to show how impactful teachers can be in your life. If you had a teacher
Truly.
that really got you into this.
Truly.
That's great.
It's kind of amazing.
Right.
I feel lucky to have known this. I mean, I think a lot of people go through different career changes and not knowing what to do and what really feels satisfying. I mean, there are plenty of days where I feel like, especially in grad school, I thought, why didn't I go to business school? I could have been done years ago. But it's really worth it. I think for me personally, it's been really worth it.
That's wonderful that you still feel, now that you love what you do, and that, exactly like you said, it's worth it and worth all the school and all the time that you put into it. So you said that you first started working with veterans at the VA, and then you had forensic psychology and you were working with the courts. So how did that transition kind of come about? How did you go into working with the courts? Was it just kind of something that happened, or was it something that you were interested in and sought out? So how did that transition kind of work for you?
So I think that initially started, with my interest in psychological assessment. I mean, I think that's one thing that is important in trying to understand someone, or, finding different ways of explaining phenomena and relying on those materials and that information that can be found in psychological assessments. So that's where this all started in grad school. But I'd always had an interest in working with the courts. I still think it's also an area that I've learned a lot about. And it's always challenging. I think, testifying in court is so relevant to the courts. I mean, you're trying to help the finder of fact understand, you're describing to the trier of fact something that's happened. And I think that's can be really helpful to judges or juries in understanding a phenomena or a situation. I had a really great mentor, and I think this is where mentorship is really important. And I just called her and asked her, and I said, I'm really interested in this. Can you show me how to do this? And she was so gracious, and she still is. And she said, yes. And so she brought me in and showed me the ropes, and I really respected her process and her work. And I've been really fortunate to have those types of people in my life. I mean, this has happened over and over again, to having a lot of people really open up about their process, their work, the trials and tribulations of the work as well, and staying connected. And I think that's been really important. I had that at the VA with a mentor there. She was amazing, and she still is, including this forensic mentor. And doing that has kind of opened my network of people in contact. So if I've got questions, or I need a journal article, or I need something very specific, I fortunately have contact with people who are willing and able and wanting to share that. And that's been super helpful. So it's best not to work in a bubble, and that's what I found, to really expose yourself to different ideas things, situations, and again, to remain curious, being open to knowing something else or learning something else, even about something that you think you know a lot about. I mean, I think that's really, really helps inform us.
That's wonderful. Always continuing to grow and learn.
Oh, yes.
On go.
Yes.
And so for the time that you worked at the VA at the Central Texas Veteran Healthcare System, how did you first get your foot in the door and start working there? And also, what would you say is something that you really learned from your time working there that you still take with you now?
Mm-hmm. Oh my gosh, that's such a big question. So how did I get in there? Kind of like other things. I called up Dr. Sharon Wills and said, "Hi, I'm a psychology student. This is what I'm doing. Can we meet? Can I talk to you?" So she gave me her time, and we met. And I told her about my research interest in studying post-traumatic stress disorder and females in the military and female veterans. And we took off. I think we connected personally, but I think we also connected around these ideas of trauma and treatment and research and kind of working toward decreasing symptoms that this group of people is experiencing based on a specific traumatic events. So that was really wonderful. That's what I did. And then, you have to have, your work product to support you, so making sure that you're crossing T's and dotting I's in graduate school and being able and willing to work with veterans. I still work with veterans today. I mean, I really find it very, there's something that's really special about this group of people. I think they give a lot, they do a lot. They've earned a lot, and I've often thought about where this comes from. My dad and his brothers were in the military. My husband's father was in the military. My husband's brother was in the military. One of my nephews is he's in the Coast Guard. I mean, so there's and so many people have a connection to this, and I think it's really important to give this population its due. And really be thoughtful about it. And also know that conflict exists. And so this will always be a population that we will need and that we will need to support as well. And so I think that's really underscores a lot of my respect for this population.
Right, of course. I also saw that you were interested in researching other topics as well, such as immigration and multicultural issues. So kind of how did you get interested in researching these topics as well? Why did you think that this was something that you would like to pursue in your research interests?
Mm-hmm. Well, I think it goes a long way back. And one of the areas that happens in is just, again, remaining curious about people. So everybody's got a culture, everybody's got a history, everybody's got kind of more broader cultural mores, if you will, and also very specific ones. When you think about families, what's the culture of the family, what's happening there? And so stepping into a situation where the research tells us this group is like this and this group is like that and this group is like this, and that can be across the areas of race, ethnicity, sexual orientation, sexual identity, all of these different ways of how people conceive of themselves. I think we really need to explore that. And it also has to be part of how we understand someone. So the question of culture is so relevant. And I think for so long it was overlooked and just a lot of assumptions were made. And I think that we are learning more. And when we, kind of like Maya Angelou says, when you know more, you do more, and so that is something that I think should be present in any piece of our work, considering any person. That's kind of the more multicultural piece. How does all of this fit? Even in a question of generations, how am I living my life differently than my grandmother did? Than, my children will or do even now. so those are different ways of thinking about this as well. The question of immigration, I think, I first really took an interest in two ways. One of them is conducting evaluations for immigrants. So doing forensic work related to immigration waivers and the question of immigration. That's something that I've done and I enjoy doing as well. But my husband, before he was my husband, was working on a documentary film about the experience of immigration. And because we were both interested in this area, along with the area of trauma, and how immigrants may have a trauma coming here or experience a trauma coming here, but this film was really about the experience of people who are left behind. So, the film is about Mexicans remaining in Mexico and seeing their families and friends move away to the United States. So that was a film I started helping with, working on, and that really elevated my interest in the topic as well. So coming at this from a research perspective, but also from a forensic assessment perspective, trying to understand immigrants and how they manage their lives while in the United States.
Wow, that's great that you got to experience kind of that documentary and be able to see a different perspective of it. Because like you said, a lot of time you see the perspective of the people that come here to the United States, but there's also people left behind that are really impacted by it. So that's great that you got to see that. And then also kind of touching on something that you said earlier, you have your own private practice. And
yes.
How did you decide that you wanted to create your own private practice? When was this something that you said, I'm going to do it, we're going to go for it, and this is something that I want to have?
It's something that I always wanted to do. I think, I really enjoyed working at the VA, and I definitely consider that as a possible career path. Again, finding it very relevant and meaningful as well. But I also knew that I wanted to have a family, honestly. And I think having children dictate how I spend my time was a real variable for me. And so what a gift to be able to create a schedule and be available to, in the office, if you will, during times when it worked for my kids and my family. And so that was definitely a huge consideration for me whenever I decided to go into private practice. Also, my dad always had his own business, and he worked very hard at it. And I always found it something that I wanted to do as well, something to aspire to, something to really be involved in growing something yourself, with the love and support of the people around you and the help of people around you as well, but really creating something. I think it's really, I enjoy telling my kids about it whenever I go to work, and what that means and how it provides something to our family, but it's also meaningful for me. And although I miss them very much when I'm away, which, it's also, I think helpful for them to see me doing that too.
Do your kids like to ask you questions about how your day's been or anything like that? Something that you like to talk to them about kind of when you come home?
Yeah. I mean, I think they're curious, and as they get older, it becomes less abstract for them, like mommy goes to work in an office, like what does that actually mean? Or she's going to court today. What does that mean? And I think that they get more and more information about that, as they get older and they become more curious. I'll tell you that the question about work and that part of the day and what I've done is, pales in comparison to hearing about what they had at lunch and who sat with who, on the playground and what math assignment or lesson was done, and which is definitely more interesting to me than me telling them about what I did or how I spent my day.
Right, having them tell you about their math lessons is a great thing. Having them go through their day at school, always interesting to hear.
Yes.
And so kind of transitioning a little bit into general mental health, and also the area that, I'm kind of interested in, the general mental health of Latinos.
Mm-hmm.
So obviously what you do, what you've done in your career, mental health is such a big aspect of your job. So based on what you've seen during your time, what do you think makes Latinos specifically more or less likely to seek mental health treatment, to go see a psychologist, to go to counseling, as opposed to other ethnic groups? Do you see a difference?
I'm really trying to think about that question. I mean, I think in my practice and in my time working with, um, people of different ages and people of different ethnicities and backgrounds, I have to say that my practice has been pretty varied in terms of ethnicity and race. I mean, I definitely have met with Latinos, I think it depends on what city you're in. My training was all in San Antonio. I met with Latinos all the time in San Antonio. So that was one thing. In Austin, it's a little bit different. I think our population's a little bit different here. So um, that's one, I guess, in terms of people who are coming to treatment, um, that's one area. But, I've had several Latinos who have met with me and have met with me for extended periods of time, and who, we ended treatment and everything was dandy until COVID came. And so people have been calling and coming back. So that has happened as well. So I think Latinos, if we try to take this as a huge group, I think it's hard to say as a group, again, this group tends to do this or that. But in terms of participation in treatment with me, I think it's been really good. And I hope people find it beneficial. I will state the obvious. I'm Latina, so that might, asking someone else, it may have a different answer. In terms of, my picture is posted on my website, for instance, like I look Latina, so I think that that's definitely very relevant when people are maybe looking for a therapist.
Right, of course. And do you think that there are any stigmas that exist surrounding mental health that kind of affect those in the Latino community? Or do you think that there's, I guess, just stigmas in general that really affect, willingness to go and get treatment for mental health issues, or just mental health in general, the stigmas around mental health? Is that something that you see? Is that something that you've experienced throughout your career?
Sure. I think there's stigmas about mental health in general, and with the Latino population. I think that that's certain. Um, as I think about my time, in this area and training in this field, I think there's been a lot of work and a lot of effort at destigmatizing mental health, at destigmatizing somebody needing to go to talk to a therapist, somebody needing to be on medication, someone needing to participate in group treatment, someone, um, needing to be in an inpatient hospital setting. I think we've done a lot of work as a community to destigmatize this. Um, your question is about Latinos specifically, so I want to answer that as well. And I think part of that is I think it's difficult whenever there are situations when there's a family unit that's so close and contained, which works in very beautiful ways, in that it's a support system and it's an area of pride for many families to have this beautiful, sweet, helpful unit. But I also think that sometimes whenever that exists, it's really hard for someone to step out and talk about the things that have happened in their family, which is really important to do when you're in therapy, to really put it on the table and to try to gain some insight into how those systems work, how you contribute to those systems, and how this works together. I think it's difficult for people to come and be open and honest about those things. One, I see that with males and females for sure. that's kind of one of the things I think about whenever um, thinking about treatment and willingness to participate, and how long people stick around as well. How much can they tolerate participating in it? I mean, because when you're in it longer and things get, you just keep chipping away at this very in some ways defended and guarded position. uh, it's hard to stay in and really think about this and participate and see how you change. And so I think that I have seen and noticed. And as people change and they're in a system, the system changes or the system responds, and it can be a very positive thing. Like, how great, I mean, we're all supportive of you or liking that you're making these changes, or it can be very threatening to a system when one person changes. And so working through that and working through the evolution of relationships within that family system, I think is really important to watch as well, and difficult for the person participating.
Right, of course. And kind of touching on what we said earlier about your interest in immigration and seeing, how your time working with your husband on that documentary and seeing that kind of interested you in this field and in this topic, would you say what are some of the struggles and the mental health struggles that you think are pertinent to immigrants who come to the United States, as opposed more generally at just looking at Latinos? What do you think are some of the mental health hurdles and issues that you see within the immigration population that you think are important to know?
Oh, sure. I mean, a number of them. I think, definitely coming to a different country and having high hopes, aspirations, ideals, and having that be not as accurate as you might have thought before coming over. I think that's one thing. So a little bit of um, kind of a really reality test for, what your fantasy was about being here versus what it actually is. I think that's one thing. So um, one area, I think a huge loss and sadness about leaving, your country. And some immigrants who come here can easily go back and come and, have the ability to go home and visit friends and family. Some don't. And so working through those issues, I think, is super relevant. Um, Coming to a country and feeling very welcomed, or coming to a country and feeling very shunned and and even threatening. I think those are um, definite struggles that I think immigrants face. And I'm thinking of immigrants who come and work in a very kind of um, manual labor type of jobs, to immigrants who come here and are sitting in C-suites. I mean, I think there are definite preconceptions that some people may have of immigrants, and I think that really um, is evident or can become evident to immigrants who come here. So all of these factors are at play. Not to mention, you know, just missing your family home, missing your family traditions, missing the food, the smells, the sights, the feel of your home that you came from. All of those things change. All of those things are different. And it's, I think about 18-year-olds who leave their parents' homes and go through a similar process. Missing your home, having a new life, whatever. That is relevant, but it's also what we expect. It's kind of developmentally appropriate, if you will. These are things that tend to happen around that period of time in people's lives. Immigration is different. It can happen at different times of your life. It can be your own willingness. It can be coming with a parent. It can be being forced out or out of fear in the situation that you're living in. It can be to explore new opportunities in a different land. I mean, there's very many different reasons why people leave their countries. And so I think being really tuned into those and really trying to understand that is really important as I think about immigrants and as I work with immigrants, and trying to understand their own very specific experience.
Right. I think that's a really important thing and an interesting thing that you note, that the why of why they left their respective country and coming here is definitely a part of their process, right? And something that is important to understand. And then I'm kind of looking at too, so at immigrants or at Latinos in general, kind of what you've seen, do you think that there are any issues in terms of access to mental health resources? And I guess the not only access, but knowing kind of where to look, the information to try and seek help in if there is a case where maybe someone feels like they need counseling or to talk to a therapist or anything like that. Do you see that there are any issues that affect Latinos or immigrants that are important to know about or that you've experienced throughout your time as a psychologist and just throughout your time in general?
Certainly. I think making mental health services available is super important and relevant. And I think making the materials describing mental health services in Spanish or in a different language is really important. I know someone who works with the Asian American community, and they're really doing a lot of work in thinking about how to provide educational materials about mental health to this population. There are groups that definitely I want to give credit to who really provide this information to Latinos groups. However, I think there's many areas of growth in that as well. I mean, I think the number of people providing services in Spanish, I think, is really could increase. I think that's one area that the people who are doing it stay very busy doing that because it's really important. And there's lots of people who need it. So I think that's an area of growth. So having more, from play therapists to people who meet with adolescents to people who meet with adults to different types of testing, neuropsychological testing. That's a question I always get in my office. Who's providing neuropsychological assessments in Spanish? We have tons of kids who need to be tested for autism or other neuropsychological concerns or questions. And it's real limited in who can provide those services. So I would say, absolutely. I think there is a lack of services available. I applaud the people who are doing it. I think that's providing a very needed and necessary service. But I also think that there's room for growth in that area.
Right, of course. And do you think that having, those therapists who speak Spanish, who are able to communicate, not just to those who solely speak Spanish, but to those who are kind of in between or feel more comfortable, you think having that kind of makes someone more comfortable and more willing to really talk? Do you think is that something that you see? Being able to talk freely, I guess, and kind of lay it all out there.
Oh, absolutely. I think that that's really important because it helps establish rapport. It helps, someone who's coming to you trust you, or just, be willing to take that next step or be willing to put it all out there. I think that's really relevant. I have to say that there are people who really do try. And I think whenever we see people trying to connect with us, that feels comforting. So, this is not to minimize the work that people are doing with this population, because I think there's a lot of people making efforts to do that. But I also know that coming into a situation and being with someone similar to you or who you believe understands you in a super connected way is super helpful.
Right,
and
of course.
meaningful.
Mm-hmm. And so now kind of switching to what has dominated our lives for the past 8 months, the pandemic, COVID-19. Can you walk me through what a typical day would look like for you before COVID-19 hit back in March? What did you do? Who did you see kind of what did your day look like
Mhm.
before this pandemic hit?
Yeah, that was so long ago. It feels some days like yesterday, and some days it feels like, 40 years ago. My typical day, again, we stay very busy and I love it, but it would be, I wake up very early. I'm a great morning person. So I like to wake up, around 5 a.m., get up, get the coffee, try to go for a jog, and spend some time working and kind of organizing my day, then making breakfast for my kids, packing backpacks, getting everybody out the door, dropping off at school, and my kids fortunately love their school. We're so fortunate to be in this great community, taking them to school, coming either home to work or going to my office and meeting with people there. Um, some days I would meet a friend or girlfriend for lunch. Sometimes my husband and I could get away for lunch together. Um, Usually picking up kids after school, either going back to the office or staying home for work. Um, we would definitely have inevitably some type of baseball practice or soccer practice or, golf or for kids. Also meeting up with friends for dinner or meeting up with another family for dinner. Those were all very typical, common things in our lives before COVID. I mean, I think we enjoyed our time at home, but we were also really actively trying to participate with friends and family doing things in the city.
I imagine that was a hard shift, having to go from, being able to talk to your family, taking the kids to baseball, soccer, and then just suddenly in a second having to not do all that stuff and to stay home and, to kind of isolate yourselves. I imagine that was definitely a hard thing, right?
It was, but I thought, we can do this. We're going to be home for 2 weeks. What's the big deal? So we'll cancel our spring break plans. Let's, about face and figure out a plan B and stay home. And, we started gardening. We planted a spring garden. We worked outdoors. We did what a lot of people are doing. We kind of reimagined our home and thought, okay, if we're going to be here, let's figure out some spaces for kids to school and for where are we going to work. And, I think we enjoyed doing all of that. And it was something that we had to do, but we launched into it. And I thought, we've got this, we can totally do this for 2 weeks. And so whenever this thing just kind of crept and crept and crept, it was something that became very difficult. I mean, I think for all of us, we were really very careful about where we went and stepping outdoors and, how much we allowed ourselves to be out, which was very limited. So I think it initially was easy. And I think there were definitely some easier periods of time with that. I think we have been gifted with a lot of closeness in my home, with our kids, and a lot of love and support. We've had so many great times together, but it really, my kids played one baseball game each before this all shut down. And, we have a nephew who was going to marry this summer, and we had travel plans, and my brother was going to marry this summer, and they had this great wedding plans. And, none of that, a lot of that took on a different shape and form as time went on. So it's taught us to be flexible, and it's taught us to, you know, how we're all great with plan A's. Our first plan, we are all great at executing these things. The question of how do you operate whenever you have to shift to a plan B? You have to create the plan B, and then you have to do it. And that has been something that we've all learned and developed and worked hard at, because sometimes those plan Bs are amazing, and sometimes we begrudgingly do it. And yet, what are the benefits of kind of moving through this? And in our house, we're just all about being flexible. We just have to be flexible and make the most of it. So we've done our best. That's another mantra. Like, we say out loud to ourselves and each other, like, everyone is doing his or her best. We are all doing our best.
And that's all you can do, right? During this time, just try your best. That's great that you have a mantra within each other just to remind yourself, because I feel like it's pretty, sometimes you kind of focus in on one thing and it's kind of hard to remind yourself of that. So that's great that you guys have that. Just, we're doing your best, and that's all you can do during this time. Try and get through it, right?
Yes.
And then kind of looking at your specifically at your job. So how has your job as a practicing psychologist changed since the pandemic? Have you shifted towards telemedicine and doing online, seeing clients online, or how has that looked like for you since March?
Most of it, I'd say 90% of the work that I do is online. So now, as it was not before. I mean, there, on the rare occasion, I would have a telephone session with a patient, for instance. If there, and that would be for me, for most situations, like if somebody really needed something and they were out of town, and it couldn't wait to meet face to face the next week. Or, it was very rare that I would do that. And I've noticed that teletherapy has been growing, even prior to COVID. And frankly, I just wasn't sure how connected we could be to our people in this way. And thinking about how someone that you've been meeting with for a period of time may do differently with you via Zoom, or I use Doxy in my practice, versus meeting someone for the first time and this being the mode of therapy. And I always question, like, how could that really happen? We have all of this literature and all of this information about how these things work in a one-on-one, face-to-face, in a protected space, that certainly is not afforded whenever you are doing Zoom, for instance. So, boy, have I learned a lot. I mean, I think one thing that I've committed to, and the people that I work with commit to, are showing up, being dressed, doing the best we can, given our limitations. I see all types of people, some with health conditions, some that are high risk, and they are happily willing to not come in. As am I. I mean, I'm happy to meet with people this way. Because I've often thought, well, what's better, meeting with someone so you can see their face, via Zoom, or how would it be to sit masked in therapy? What would that be like? And I haven't done that yet, honestly. I mean, all of my therapy patients have been on some type of electronic platform. My assessment work, though, I'm doing face to face. I'm doing the best I can, staying distanced, masked. And in this area, some people are moving to doing this via Zoom or kind of electronically based. I'm not yet. I think there's evidence and people writing and researching about how to do this in this way. I want to see more of that. I want to make sure that it's reliable and valid and standardized. So how do we administer some of these assessments in a way that yields meaningful results? And I am just not there yet to take this all online. So after March, I stopped doing assessments. And because again, I thought, well, by June, we'll be back. I can delay a few of these cases and just work really hard at doing everything else and do that assessment piece at the very end. And I stopped doing that. I started meeting with people in the office only when necessary, masked, taking all of the precautions necessary, and making sure that everybody stays well and healthy. And fortunately, I've been very safe and very lucky to not have been infected, and nobody that I know that I've met with has either. So that's been hopeful.
Right. And kind of just to clarify, can you tell me what exactly is an assessment? What makes an assessment different than just, a therapy session with a client?
Mhm.
Why does that have portion do you feel like has to be is more effective in person? So what exactly is an assessment?
Mhm. So it's basically psychological tests. So some of, the way that the manual will have you administer the assessment, it's very specific in how you're supposed to do it. The questions you ask, the way that it's done. Um, so to stay true to that administration, um, the standardized administration, these manuals are written not to administer online. The research supporting these tools um, has been conducted with administration in person. Now, again, a lot of tests are moving toward creating assessments that can be done online. Some assessments can be done online. I think there's definitely some assessments where you can observe somebody completing the answers. That definitely works too. Explaining the process in a legal situation, it would have to happen, and you'd have to be pretty thorough about that. So that's what I'm talking about, just trying to keep it standardized, and again, explaining how we did it, why we did it that way, and what the results are. And I think that's relevant and important. One thing I didn't note is that, at least in Travis County, where I've had participated in arbitrations and hearings, they're all on Zoom. And so I've not had to be in a courthouse since this started. And I think some areas may be doing that. I have not. And so I'm wondering how the court system will change. If hearings can be done via Zoom efficiently and well, I wonder how much of that will stick around, as well as arbitrations, or as well as mediations, or these different areas that we have learned can be done in this way.
Right, of course. Thank you for clearing that up for me.
Mm-hmm.
And so kind of touching on telemedicine and doing, therapy sessions like this. You said Doxy, was it, that you do it through? So do you think that these sessions are effective? What do you think is gained by doing it online? And kind of what do you think is lost that, doesn't translate as well doing it through a computer than going in person and meeting in person? So what are your feelings on that?
Excellent question. Again, I think it depends on the type of relationship you have with the person. So I think I may feel differently. I don't think I've started a new therapy case since COVID. So the people I'm meeting with, I've met with before, and I have some type of relationship with. So I think what could be lost is not fully creating a trusting relationship initially. What is gained, however, is sticking to a boundaried therapeutic model. So, having people being able to count on 11 o'clock on Tuesdays, this is where I'm going to be, with my person who's meeting with me at 11 o'clock on Tuesdays, and knowing that we're going to meet for 50 minutes, and knowing that we're going to meet in this room. It's different. This is not my consulting room at my office. This is my part of my home office, but they will know where I am. And another thing about being on Zoom is I think I'm closer to the people than I am in my office. So, being a little bit closer and seeing them, physically seeing them, is different. Maintaining contact. I think that's one thing that we had learned and has been bolstered in our understanding about our relationships, is just maintaining contact. Being connected to other people when we are all so isolated has been really important. So say we didn't have these platforms to meet with our people, could we be meeting with them safely in an office? I don't think in March people would have said that would have been okay. I mean, I think what we've done is created, the next best thing that we know about right now to meeting with someone in this way, and to maintaining as much confidentiality as we can. Being outside, being outdoors, some climates and some areas may be amenable to that. but it sure doesn't protect confidentiality, and it sure doesn't, it changes the nature of, I think, possibly the relationship. So, being in a room for therapy or being in this mode for therapy likely feels different than taking a walk with your therapist or meeting outside at a picnic table. I think that changes things. I haven't done it, so I don't really know. But I also don't think I would do that. I think I would definitely prefer, um, and maintaining the boundary of creating this working space that has to remain intact for therapy to work.
Right, of course. And like you said, that boundary, it helps people kind of feel normalcy, if like you said, I'm meeting with you at 11 o'clock on a Tuesday, and this is what we're always going to do. So keeping up that routine, do you think is important?
Oh, for sure. Yeah.
And at what point during this pandemic, it's gone on for so long, but at what point did you really realize, man, this is serious. This is something that we're in it for the long haul. What kind of did you observe that made you realize how serious it would actually be, and how we would, kind of be in it for a while? When did you realize that? Kind of what happened? Do you think that there's a specific point at which you thought, this is something very serious, this is something that's going to be have an impact on our lives?
Yeah. So I think the seriousness question, I know it's almost palpable for me. So my husband and I took a trip in the first weekend of March of 2020. And we hadn't taken a trip without our children in a long time. And so we took this very quick, 48-hour trip. We were going to come home, get through one last week of school. And then I think on that Thursday or Friday, we were going to leave for spring break. And part of that entailed us attending a conference we attend every year together. And it's the Division of Psychoanalysis of the American Psychological Association. The meetings were in New York. So we had planned to attend those meetings, do New York with the kids in the spring. That would be lovely. See friends, see family who were there. And then we were going to spend a portion of the week in Washington, D.C. and have a family experience there. And in early March, we were hearing about this and thought, is this really a thing? Do we need to stock up? Do we need to buy masks? What's going on? I think at that time, masks weren't even an issue. It was more like, just don't touch your face and wash your hands. And when we landed in Austin on that Sunday afternoon, and we were waiting to hear what the conference organizers were going to do, they canceled. And that's whenever I thought, this is serious. We canceled all of our, we canceled our spring break and stayed home. And then I think as I learned that there was disagreement about how this virus should be managed and how we saw increasing numbers of infection, that's when I thought, this is going to be in for the long haul. Our school was canceled. That was very serious to me. And then over time, we learned that my kids aren't going back to school for this year. We're going to continue home learning. I think the resources that our elementary school had and the dedication to putting into place systems for continuous learning, I thought, if they're doing all of this, we need to take this seriously. Same thing, my husband teaches at UT. I mean, whenever UT closes its doors, that's serious. So all of these things were indications to me that, we've got to figure this out. And, on a personal level, on a family systems level, and as a community, how are we going to work our way through this?
Right, of course. And I feel like so many people have had that similar experience of what you just said. We all kind of went into it and it was like, okay, maybe this is something. And then that kind of one thing happens, and then it really hits you that we were going to be in this for a while, and that this was going to be really something serious. And so during this time, we've kind of seen how coronavirus has disproportionately affected Latino communities and minority communities. And so do you think that after, I mean, we have no idea when this is going to end, but do you think that when we start to go back to normal, whatever normal is going to look like, do you think that we're going to see a notable increase or decrease in Latinos seeking help and going to therapy, trying to get mental health resources during this time? Do you think that is something that is going to happen, or that you think we might be able to see an increase, or what are your thoughts on this?
Mm-hmm. Excellent question. I think that Latinos may seek out more services if it is clear that more services are being provided. I think that that's a kind of a two-part answer to your question. I would think that people would be more willing and able to accept services if they knew that they existed or that they were easily accessible. So being able to communicate this way, for instance, would be relevant. Some people in minority groups easily have access to this stuff. Some people don't. And so thinking about that as a variable is really important. Also, the willingness to participate, again, in therapy with someone you don't know very well. I think that's a variable to think about. So if we as a mental health community can communicate that services are available, this may, again, back to that question of what's the new normal, not be traditionally what you think about when you walk into somebody's office for therapy, but this is how we're doing it right now. This is what's available to you. And utilizing whatever resources we have right now to communicate that to families or to individuals, I think that could be really meaningful and really important.
Right, of course. And kind of taking a step back and looking at it, obviously this has been a very difficult time for everybody in this country. We have people losing their jobs, people who are getting sick, people who have had to adjust to very quickly to this new reality that we live in. So how has this impacted mental health? Not only just for Latinos, but how has this pandemic impacted mental health in your opinion? Do you see a decrease in people's mental health at this time? What have you seen how this pandemic has affected just mental health in general?
It's really hit everybody in significant ways. I think I will say from my clinical work, meeting with patients, I will tell you a number of people have returned. A number of people since COVID has started have asked for appointments and are back meeting with me. That's one thing I've seen. And in a time when I thought, I wonder what's going to happen here. Is everybody going to stop seeking out services? Absolutely not. People came. New people are trying to get on my schedule all the time. That's one thing. So from a clinical piece, I'm definitely looking at that. From a forensic psychology piece, people who have disagreements about children, on before COVID, the anxiety and fears and thoughts about how people are treating children or kind of living their lives in their own homes. So if you have mom in a house over here and dad in a house over here, those anxieties and tensions I've seen increase as well, because so-and-so is taking the kid to the store when we should all be on lockdown, or you let our kids play with the kids across the street, or are they quarantining as well? I mean, all of these things are increasing. From a personal level, we've seen and I've talked to friends and family members who are sad and lonely, who miss being with other people. Kids miss their friends. Kids miss participating in sports or having sleepovers. I know I've seen that with, the friends we have that are males and females and families. All of these families are going through these transition times and trying to keep everybody happy and entertained. But really feeling the stresses of the concern about the virus. How do we keep ourselves safe? How do we participate in our lives? that I've seen as well. So I'm really trying to think about, whenever I hear a question, I'm trying to think about both sides of it. Have there been places where people have been creative and are thriving? Absolutely. I think that's true too. However, as we know, with all of the other emotions we feel, those are experiences that we can have and then they go away. And so I think that there's a lot of tension in that. Something that's so obvious. I mean, we're talking in November 7th today, and the holidays are coming up. People are being creative about how to participate in holidays, or how to do holidays, or how to, bag holidays this year and do something very small scale, and looking forward to doing other things in the future. I mean, these are all things that are complicated, and I think that negatively affect mental health. So I could continue. I mean, I think about, the increase in domestic violence, in homes. If everybody's home, the increase in alcohol use, the increase in child abuse at this time. I mean, all of these things are happening. We're all home more. We're all living under a different level of chronic stress at this point. And that takes a toll on people.
Right, of course. And like you said, it's very up and down, right? There's high points, there's low points, and we just kind of, have to try and get through them during the time. But also looking at yourself. So obviously your job deals with incredibly heavy topics that are very important, but are also sometimes very heavy and very impactful. What do you do to maintain your own mental health, your own well-being, especially during this pandemic that really has been, very difficult? So what do you do to try and maintain your own mental health and making sure that you're okay yourself?
Yeah, a number of things. Trying to get exercise every day, and that could be jogging, that could be an at-home, yoga class, that can be riding bikes with my kids, literally digging in the dirt outside and getting into the earth, if you will. We had a spring garden, now we have a winter garden. So, we're really doing things outdoors. That keeps me healthier. Also, one thing you mentioned earlier that I'll come back to is having a structure and a calendar. So I'm an individual who really needs that, and I do best whenever I know what's happening at one specific day and what specific time, maintaining that. So that means for me meal planning, and that means for me, making sure if my kids are home and we're not, participating in soccer or baseball this spring, this fall, what we are doing are, pianos at 3:15 on Tuesdays, and we're doing outside, ninja training, on Wednesdays at 4, so making sure we are all abiding by schedules that seem routine to us. We're going to bed at the same time. We're waking up at the same time. Saturday morning, we still make pancakes and bacon, those are the things that we need to maintain. Something that my husband and I started, or we intended to start before COVID took place, is taking each of our kids out once a week for individual dinners. So spending one-on-one time with each child and taking turns. We've done that. Our dinners look a lot different. It could be like packing up a picnic from home and going to a park, or, doing takeout from somewhere and spending time together. So still trying to create these moments where it's not 4 of us all the time, but really trying to give each kid individual space, trying to get that for ourselves, and give it to each other as well. Something that's really been extremely helpful for us is being a part of a team. 2 other families who are regularly testing and being more comfortable with them and being open about, got my hair cut this week, so choose whether or not to be around me for the next 14 days or whatever. Just the call and the charge to be honest with people and transparent, I think has bolstered our trust in other people, and called on us to say, my kids are going to start playing an outdoor sport. Think about how that might affect how frequently you see us or under what conditions or not at all. But, you know, these are things that we're moving toward. That's, that's all been helpful to me. Calling my family, FaceTiming with them. Um, Off and on, we've done with my husband's family and with my family, like Zoom dinners or Zoom meals where we've all gotten together and made a lasagna or kind of made a complete meal and then Zoomed together at the dinner table and had that. We have a group of friends who have this wine and cheese night every so often, and they've continued to do that. They, you know, sweetly, kindly drop off a bag of treats, and we all get together. And the kids have their Zoom, and the adults have their Zoom. So it's about being creative and making efforts to unite with your people and stay connected in meaningful ways, and that's been helpful.
That's great that you've been able to have those nice moments throughout this, and be able to go out with have time with your kids and be able to do those wine and cheese Zooms. I think that's really great, and being able to get through this really difficult time.
Yeah.
And also, like you mentioned, you're married to a psychologist. Your husband is also in the same field. So are there ways that you two have kind of helped navigate this difficult time with each other? Is there, do you guys kind of have a better understanding, or what do you have you guys done during this time that have kind of helped you navigate this difficult period?
I really think getting back to understanding that everybody's doing the best that they can. I think that's one really important piece. And then also actually doing the best that you can, right? And so, understanding that about the other person, but also knowing that that's what the intention is, your intention is to do the best that you can. Taking some time when you need it, whether that means my husband's in a band. He loves his band and he, enjoys it thoroughly. Continuing to practice outdoors, distanced, and, him taking that on and doing that, keeping that space for him, and me supporting that space for him, and also trying to spend time together, which I think is important, which is something that we easily did before. It's harder to do now when you're with your kids all the time and you're home all the time. So I think that is something. Reading, we've listened to different books on Audible, or, trying to find different ways of doing things together that are also fulfilling. So gardening together, getting the bike rack on the car and the four of us going for bike rides together, doing those things that we might not have done otherwise, or definitely wouldn't have done as frequently in the past, really doing that, keeping ourselves healthy, that's really important, as well. And supporting each other's time and space and wishes, is also really important. Yeah.
And then also, you are a boy mom, correct? You have two small boys. And so
Yeah.
what has this pandemic been like for you as a mother? I know we've talked about the changes that, your kids don't go to sports anymore, having, school be canceled and having to do it at home, spending all your time with them. But what has this pandemic really been like for you as a mom and having your two boys with you? How have you been affected as a mom?
Mm-hmm. Oh gosh, I could probably say so much about this. Again, in so many ways, it's been a real gift to us to be able to spend this much time together. My two boys are great. They're amazing people, little people, and I've loved seeing them grow and really getting to know them in these ways that I wouldn't have otherwise if they're dropped off at school and I pick them up and we make dinner and read a book and call it a night, 5 nights a week. Excuse me. So it's been really amazing to see them learn and be part of that in a different way. I mean, excuse me, I feel like we're involved parents, and this has really even made it more important to be on a team player with teachers in the school. Excuse me. So I've thoroughly enjoyed my time with them. In this time, my kindergartner, is fully on his bike completely. My older son is reading more and more, and just watching them develop in these ways is really great. Also, watching their relationship grow has been so sweet and amazing. I could just cry. I'm like tearful thinking about this, because it's very sweet. It's a very sweet, connected relationship that the two of them have, and I love watching that and also being a part of that. It's been really amazing. It's also been challenging. I mean, having two boys who are very active and who really need to play soccer every day, or hit a ball, or, challenge you to a race, they need me in a very real and different way. And being able to show up for them, and also show up in my work, and also show up to make dinner. I mean, these are all things that I think moms have struggled with, and I've read about, since COVID has started. There's a lot of, thankfully, research and people who are interested in this topic, trying to understand what's going on, be supportive of each other, and again, do the best that we can given the circumstances. I mean, I think that is incredibly difficult. All of our lives changed. I mean, at least for parents who send their children to a traditional education, meaning send them to school, not home learning, whether they're working moms or stay-at-home moms, had that experience, of taking your kids to school. Everything changed immediately, abruptly. We had no warning, and we had to about face, and it's been a challenge. I mean, that's absolutely true. So we have to figure this out. We have to learn from these experiences. Some of it has been an evolution. I thought home learning, my kids will sit together at a table and each have their headphones on, and I will sit next to them. Everybody will be working, and it's going to be easy and great. And boy, we have evolved to different desks, different rooms, and floating, between kids and their sessions, and really making that work. So I think learning about each other, learning about ourselves, and being able to be flexible. I think that I've learned as a mom. And that means in my work too, waking up earlier and working before they wake up. Making a difficult decision to hire a tutor or nanny to come in and help us out, and that was a risk with coronavirus, that bringing somebody from outside your home into your home. We did it, and it's been great. So also knowing when you need some help and being able to call on that and secure it. And it's been really great for us to have someone who also cares about them, who can really assist in those areas, which gives me more time to run my business and to be more available to them as well. At the end of the day, I am making dinner, and we were talking about whatever you did today. I'm not trying to do multiple things at once. That's been a game changer.
It's finding that balance, right, of being a psychologist and having your job and having your work, but also being a mom at the same time, and online learning, being able be with your kids in that, right? So it's been trying to find a balance between the two, would you say?
I mean, yes, I take a little bit of pushback. I kind of take issue with the word balance, because I don't think that exists. I really don't. I mean, I think it's more about making it work, giving what your kids need to them and giving what you need to yourself, and trying just to fit it all in. I wonder how many people actually feel balanced, because that's a tall order. But I think that, again, just trying to be creative about what works for you and your family, and not be prescriptive about you should do this or you should do that. And all of those suggestions can be very helpful and lead you to coming up to some things that may work for you. But trying to understand your family, your children's needs, your own needs, your partner's needs, and how to be considerate of all of those things. And also say, you know what, we're going to have to let this go, whatever that might be. This is going to have to go for today, or for this hour, or I've got to punt this to next week, or whatever that might be. Being realistic and being okay with that, which I think is really hard for moms to do, or people to do, and say, gonna have to that's not going to be ready in time, or, I'm not going to make this amazing meal tonight. We're going to order a pizza, or, it can be low to high on those areas, giving some of that up and being okay with it.
That's a great point. Balance is so arbitrary at this point, trying to say that. Yeah, that's a great point. And then now kind of looking towards the future, the big scary future, and what this means for us moving forward. Although, it does seem incredibly far away, we have no idea when this is going to end, when we're going to get back to a new normal, when we're finally going to start to see a big decline in cases. It's just so far away. We have no idea when this is going to be, and what it's going to look like. But after this pandemic slowly starts to come to an end, whenever that may be, what is something that you think needs to change in order to better address mental health in general, and also mental health within the Latino community? What are changes that you think have kind of been exposed, areas that have been exposed because of coronavirus, that you'd like to see improvement on or change on moving forward?
Yeah, amazing question. And these are things that I've thought about. I mean, I have given this some thought in the past, because, living through an experience like this and going, okay, what do we need to take away from this? What can we learn from this? And I think that's partly what you're asking. I think educating the public, and that could be the Latino community very specifically, or a larger group, that taking care of ourselves and each other is really important. So not waiting until there's a crisis in your life to seek out mental health services. I think there's a lot of preconception and maybe misconception related to mental health services, and how traditionally they've been utilized by people who have more resources. And I think that we need to work on that as a greater community, to make it available to all people, and I think that is highly important in communicating this message. It's kind of like doing your wellness checks and getting, your once a year physical, or whatever that might look like for you. But having a check-in, this is, I think, psychologists and mental health is equipped to handle crises, and we have systems in place for that. But it's also okay to go in and kind of be mentally fit, if you will, on a more regular and consistent basis, in terms of preventing what might be dips, it could be anxiety or depression, or, other mood issues or concerns. Also having a support system. So, therapy is used to work through issues. There's a lot of uses for therapy, but it can also be having a stable relationship that's boundaried and that's useful to you. So when something happens in your life, there is a trusted individual that you can turn to kind of help figure this out in an objective way. So I think I would like that to be the communication, that let's not wait until there's a crisis. Let's not wait until there's a substance use disorder. Let's not wait until someone's, on the edge. Let's make services available. Let's get people in and having a sense of security and bolstering, especially in a situation in a time whenever it's really hard to have that, whenever we're living in this crisis, this chronic crisis situation where it's hard to trust, information. The ground under our feet seems to be shifting all the time. And so having a place where things seem really stable and really grounded, I think is really important. And if more people had that, I'm curious as to what would happen.
And kind of on that same token, obviously we had a presidential election this Tuesday. We don't have the results yet, and this is something very, very important within our country. Like you said, watching the news all this week, kind of seeing the updates on that and having that constantly in our minds. Going forward with whoever ends up being president, whether Trump stays president or Biden becomes president, what is something that you would want the upcoming president to address concerning mental health at like the federal level, looking at it very, very big picture? What is something that you'd like to see change and something that you would like to see be better addressed or be better dealt with this new presidency coming up very shortly, whenever we find out who that ends up being?
Yeah. Excellent question. I want to say that in the period of time that we've been on this interview, my text messages are blowing up because I do believe we now have a president since we've been on this, like in the last 5 minutes. So I'm focused on this, but I know that this has happened because I'm seeing little side messages. I think that this doesn't have to be a political question. I think that it's a healthcare question, and I think it's a community question, and I think it is a question about having resources, which we have, and using those resources and using people who know how to execute these situations. So having an advisor who is in mental health, who can handle these bigger questions at a level, with an ear to the president or with an ear to administration officials or with an ear, who really is on the ground with this, I think is a good place to start. Having somebody really work on these questions, and then having a plan to increase wellness, again, not having to work in a crisis situation, but having availability of services to a large group of people. I don't know what that looks like. I don't know that, it can be, twice a week psychotherapy for every person, but having educational materials, having resources, having individual therapists, having opportunities for this is so important. We know that psychotherapy is helpful. Having space for that, communicating to people about that is, I think, could make immense change.
Of course. And kind of looking at it, we're in a pandemic right now. This presidential election is very important for the future of our country. How has that, in conjunction with coronavirus, this election, it wasn't a one-day thing. It spanned over the course of a couple of days. How does this impact mental health? Do you think that this makes people more anxious during this time? This just adds something else? Or do you think that there is an added impact of mental health with something like the election in a time where we are in a pandemic and we're already dealing with the repercussions of the pandemic, and then adding this other very important aspect or this very important event during this time? Do you think that has an effect on mental health?
Absolutely. I mean, I think without question. And it can be, it can be demonstrated in different ways. So people can feel very depressed, despondent, without hope. that can be one area. People can feel very anxious, very hypervigilant, if you will, very paranoid as well. This side's going to do this to us, that side's going to do that to us. And that's definitely, I think, happening. Another area is just this high level of contentiousness that we have. It's really, I think, is leading a lot of people to question, what family members think, what friends think. Friendships have been lost, families have been strained. And I think this is not an unusual phenomenon. I think this has happened in the past. But from everything we know, this is a really highly charged situation. And I think the fact that we're in this situation where it's been days since the president has been confirmed really speaks to how fractured our system is. And so whichever side you're on, you are with half of the nation and the other half of the nation is on the other side. How do we settle this? How do we wrangle with this? Just because we have a president doesn't mean that things will easily or quickly de-escalate, that we're going to experience calm, that we're going to experience support for each other in the immediate sense. How do we work through these issues? I mean, I think these are huge questions. And I also think they affect us in a community-wide level, like a nationwide level, or if we know they affect us in individual levels as well. I mean, thinking about, I would love to read the research on this later, thinking about just everyday regular stress, job, money, think about the list of factors that people experience stress over in a regular day. Add coronavirus on it, add, the financial system, add jobs, add, every kids at home, add all of the changes we've very quickly endured, then to add this other element of contentiousness in the political system and the political parties. And those are all huge weights that I think are affecting us. I think that we're not only seeing more mental health problems, but not a physician. I'd love to hear a doctor speak to this, but I'd be willing to say that my belief is that physical problems are also increasing. I mean, and that can be, GI issues, headaches, migraines. So all of the ways that our psychology affects our physical health, I got to say those problems are increasing as well. Whether it's tension in your back, much like I experienced, to, a general level of chronic fatigue that you can't get out of bed. It might be depression. It might be something manifested more physically, but I think we've got to see all of those things.
Of course, you bring up great points. I didn't even think of that, how mental health can also kind of translate into your physical health as well, and impact that as well, especially with all the stressors that have kind of been thrown at us these past couple of months. That's a really interesting point. And so that was the last question that I had for you. Is there anything that I haven't asked or anything that we haven't talked about during our interview about this topic that you'd like to tell me or that you'd like me to know?
I really appreciate the work that you guys are doing. I think these questions are relevant. I would love to listen to other people's interviews, and frankly, I'd love my children to watch these in the future, or children to watch these in the future. I'd want to know what we've done in 20 years. From 20 years from now, to look back at this interview and go, gosh, what was going on? How did we survive that? How did we move through this? So thank you for spending the time to do this work. I think it's super relevant. And it's part of being curious about what's going on with individuals and with groups. And I think that can help inform us for, what we do when the next thing happens, or, how do we learn about Latinos? How do we learn about mental health? How do we learn about these areas that really need to focus? on a day-to-day sense, but especially during these times.
Right. And thank you. I really appreciate you saying that. And that's
Yeah.
exactly what this oral history project is about. As soon as the pandemic hit, and we have a lot of interviews. If you go through the YouTube playlist,
Okay.
there are different talks with different people, healthcare workers, farm workers, people who have lost people during this time. And so being able to document that and ask those questions, exactly like you said, to show your kids in 20 years, show where we were at this very significant moment in time, and
Yes.
how how we looked like now, and in 20 years or 15 years, whenever, kind of looking back at it and thinking, okay, this is where we were at, and this is how we got through it, and this is how we progressed. And being able to physically have that and see that, and ask these questions, is something very important, and something that this oral history project, I think, has done really, really great. So thank you so much for taking the time to speak with me. I know your life is so busy and so hectic, and so I appreciate you taking the time to have another a Zoom meeting, another meeting added to your day, another thing added to your day. I really do appreciate it. It's been absolutely wonderful getting to talk to you
You
about
too.
this topic.
Yeah.
Again, thank you for taking
You bet.
out of your day.
Absolutely. Thank you.
I really enjoyed this interview. Let me go ahead and